Wealthy people who become addicted to drugs can check into expensive rehab centers for months at a time, if that is what is required to help them. But for the poorest of Canadians, who live in conditions of extreme poverty, enslaved by an addiction for which full recovery is possible, we have been offering supervised injection, needle exchanges, and crack pipes. We have been offering drug maintenance rather than drug treatment. We have been sending a message: we have given up on you. We do not expect you to recover. Now, Vancouver Mayor Sam Sullivan, just a few weeks ago in an editorial in the Globe and Mail, called the SIS, quote, palliative care. This echoed the report of a committee struck by the BC Medical Association in 1997, which called harm reduction, quote, the palliative care of addictions medicine. Palliative care is what you give someone when there is no more hope. It is end-stage treatment when every other solution has failed, and we just wait for people to die. But injection drug users do not necessarily have to die. There is still hope for them. Even if they fail treatment the first time, we can help them to get up and to try again. In purely medical terms, it is unethical to offer palliative care when treatment could help. There is a notorious lack of treatment beds in the downtown east side, and while I would quickly assert that people at Insite have the best of intentions, I think the site itself...
A point of order, Madam Chair, please.
Yes, Dr. Fry.
With due respect to the Minister, I would like to know how much further and how much longer his presentation will take.
About 2 minutes.
We had set
2 minutes, Dr. Fry.
For other
and then
other
you
witnesses.
have a whole 15 minutes.
Madam Chair,
first on
that's not my question.
To ask.
We had cut off witnesses.
Dr. Fry.
This guy's not doing it.
Dr. Fry, he has 2 more pages. You have 15 minutes after that to examine the Minister.
Madam Chair, I wasn't
Can we
even
continue?
Thank you. There is a notorious lack of treatment beds in the downtown east side, and while I would quickly assert that people at Insite have the best of intentions, I think the site itself represents a failure of public policy, indeed of ethical judgment. I suggest then that while the science is mixed, the public policy is clear. Further, I want to talk about the ethics of diversion. Every dollar spent on the supervised injection site diverts $1 away from treatment, leading to full recovery. And let me do the math by giving you an example. The 20-bed treatment center I announced on May 14th will be able to treat 80 women per year, or 400 women over its 5-year lifespan. With just this amount alone, 1 in 4 female sex workers in the downtown east side will now have the opportunity to escape the cycle of addiction, of violence, of victimization, crime, and abuse. It's an initiative of which I'm very proud, and something for which I commend our partner, the Vancouver Coastal Health Authority. Now, if the $3 million per year used to operate Insite were to offer treatment beds instead of injection, 1,200 more female sex workers could receive help over the same 5-year period. Together, we could guarantee that every female sex worker in the downtown east side would have an opportunity to escape their sad existence over the next 5 years. They could have hope for a better life. Female sex workers now make up 38% of the visits to Insite. Is it wise or ethical to use this money to help keep them on drugs instead of getting them off the street? Is this compassion? I would assert that it is not. As mentioned, the evidence is that Insite's injection program saves at best 1 life per year. A precious life, yes, but I believe we can do better than that, and we must do better than that. We can do better than simply warehousing people addicted to drugs for palliative care. If it were my son or daughter trapped in the misery of the downtown east side, I would want health workers, and more importantly, I would like my government not to give up on my child, but to help me win him or her back into society and into health and wellness. That is what this government's national anti-drug strategy is all about, and what we need to think about when addressing the exemption at Insite. This much I know as Health Minister. The illicit drugs which are being injected as part of harm reduction at the supervised injection site are harmful to human health. There is no debate about this. The long-term effects of injecting heroin include collapsed veins, infections of heart lining and valves, abscesses, and liver disease. Pulmonary complications and pneumonia occur more frequently in street heroin addicts. Cocaine can result in cardiac or respiratory arrest. Additives and impurities found in many drugs purchased on the street may not dissolve readily and result in clogging of the blood vessels that lead to the lungs, liver, kidneys, or brain, causing infection or even death. Sadly, we expect and see about 50 deaths by overdose in Vancouver each and every year. In my opinion, supervised injection is not medicine. It does not heal the person addicted to drugs. Each and every injection, along with the heroin and cocaine injected, harms the person. Injection not only causes physical harm, it also deepens and prolongs the addiction. Programs to support supervised injection divert valuable dollars away from treatment, and government-sponsored supervised injection sends a very mixed message to young people who are contemplating the illicit use of drugs. For these reasons, Madam Chair, and fellow committee members, I can inform you today that I will be asking my colleague, Rob Nicholson, the Minister of Justice, to appeal Justice Pittsfield's decision at the earliest possible opportunity. Thank you, and I'd be happy to take your questions.
I would like to ask the Minister of Health. He referred very much to the rule of law. He referred to the fact that a particular police officer who worked on the drug squad had some negative things to say about Insite. I would like to quote Cash Heed, who was the commander in charge of drug policy for the Vancouver Police Department at that time. Mr. Heed is now the Chief of Police for the West Vancouver Municipal District, and he fully supports Insite's results. He believed that it achieved its first thing, which was decrease of public harm and increase in public order. The Chinese Business Downtown Merchants Association, who were opposed to the setting up of Insite at the beginning, are now fully in support of it. They have seen the crime rates dropped. They feel that they're able to walk their streets now, so they now support it. I am speaking about the people who live in the area, who have worked on this, and who fully know. So I think that the commissioner in charge of drug policy at the time and the business community there have fully supported Insite. However, the minister speaks very much about the fact that this does not work. Madam Chair, you've heard that over 2,000 people died in the 1990s. Today, Insite was not set up for every single drug user. Insite, as I can tell you, having been involved, was set up to look at a very high-risk population of users. These are the people who do not access healthcare services. These are the people who will not go to treatment. These are the people who have the highest incidence of infectious diseases because of their intravenous drug use. These are the people who needed help and who were dying. You have heard that those people accessing Insite, there were 0 deaths since then. 0 deaths, Madam Chair. And in 2005, 2,270 people went to health services withdrawal facilities. In 2006, 1,828 people attended Insite did the same thing. In 2007, 2,269 people attending Insite went to treatment and detox services. So this is not one death, Madam Speaker. It depends on how you value people's lives. Now, the minister speaks to the rule of law, and I would like to refer to Justice Pittsfield's response when he said that, and I want the minister to answer this. Canada argues, the minister argued, that in fact the Controlled Drug and Substances Act, Section 4.1, did not offend Section 7 of the Charter. Mr. Pittsfield was very clear. He said, I declare that Sections 4.1 and 5.1 of the Canadian Drug and Substances Act is inconsistent with Section 7 of the Charter and therefore has no force and effect. He also went on to suggest that in fact when the principles of fundamental justice are amongst the most important in society, and any law that offends them, mainly the right to life, the principle of life and security, has been offended by the minister's proposed actions. I want the minister to respond to me about how he believes that the ability to save one life that the minister so casually dismisses is an extremely important thing. And just because that life is not worth the minister's time doesn't mean that it's not important. How can a minister who is supposed to protect the people of Canada with regard to health and safety refuse to administer life-saving services to a group of people who would die if they do not get it?
Thank you for your comments and your question. I, in fact, agree with you that every life is precious and every life is worth saving, and that's precisely the point of my arguments, that the best way to save lives, the best way to ensure that we have compassion in our society is to treat those who need our help, to prevent others from getting on the drugs in the first place. And while that one life that was
Minister, could you
projected
please answer my
to be
question?
saved by Insite is precious, if we can
answer the
save
question.
10 lives, or 50 lives, or 100 lives, that should be our aim and objective. And I believe that through our plans as a government, the
Thank you
National
very much,
Anti-Drug
Minister.
Strategy,
Madam Chair,
that
may
will
I
save many more lives
ask the
than
Minister a question?
Dr. Fry
Madam
proposes
Chair,
to do.